that's the part that's most difficult. Understanding the device and reading the data and all that, easy. But then saying, would I feel comfortable if this device was used on one of my loved ones, right? That's my litmus test.
Okay.
Right? So, and if the answer to that is no, you have to be confident enough to say, you know what, you don't have sufficient data. That is actually pretty hard because, especially if it's, say, it's a startup, they have a project that they think is really cool. Now you've called their baby ugly.
Hey folks, welcome to another episode of the Next Step podcast. I'm Jeff Kozlowski, a senior marketing strategist here at SMD, supporting our graduate education and postdoctoral affairs. We're fresh off commencement here at U of R, so let me be one of the many to offer congratulations to all of our graduates. This episode, we welcome Stefan Burde. He is currently the Director of Global Strategic Business Development for In Vitro Diagnostics, or IVD, as it'll be referred to throughout this interview. He's at a German company called TÜV Süd, which is a notified body, and a notified body, as Stefan puts it, is like the equivalent of the FDA's role here in the US. They do conformity assessment for medical devices and in vitro diagnostics for companies that want to launch products in the European Union. He graduated with a PhD from our pathology program in 1995, and he joined us to talk about his own career journey, how he transitioned from a technical role to strategic business development, and advice to trainees exploring a career in regulatory affairs, and of course, more. Now, similar to our last LinkedIn live stream, this one was pre-recorded, but Stefan is here in the comments and ready to take your questions. So if you have them, please post them there. And without further ado, here is Stefan. All right, Stefan, thank you so much for joining us.
It's a great pleasure to be back.
Yeah, how long has it been since you last visited
I
Rochester?
haven't actually really been here since I graduated, and that was in 1995.
Okay.
Yeah, it's a long
not
time
too
ago.
long.
No, it's a little while ago.
So can you just do a quick kind of intro on when you went to school here, what your area of research was, or the program you were in, all that good stuff?
Yes, absolutely. So I got my PhD, as I said, in 1995. I was in the pathology department, so PhD in pathology. My research was centered around looking at chromosomal damage using fluorescence in situ hybridization methodology, and also the laboratory was very strong in flow cytometry. So actually some work in trying to combine those two technologies, which I think remains a bit of a challenge, but we did make some progress in that area as well.
And where are you now? You're
right now I am at a company called TÜV Süd. It's German, so it has umlauts. And that is a notified body. A notified body is kind of the equivalent of, at least the role we play is kind of the equivalent of what the FDA's role is in the US. We do conformity assessment for medical devices and in vitro diagnostics for companies that want to launch their products in the European Union. So they would submit their dossier of technical information on a device to us. We do the review of it and we make the determination. Does it meet all the regulatory requirements? And do the data support the safety and performance of the device?
And are you based in the United States, though?
Yes, I am.
Okay.
I'm home-based, actually. I've been working from home for over 10 years. And that's one of the things with this kind of work, because it's done remotely. You do it on a computer. So being home-based is pretty much standard. There's a minority of people who do the technical work who actually need to go into the office, and that's only because they happen to live close to one.
So you were home-based before it was like a thing after COVID.
Exactly,
Like
yeah.
you were already used to all that.
Yeah, in a way, almost when COVID hit, it didn't change too much work-wise. Of course,
Right.
the part that did change is you couldn't go out and do something afterwards.
Sure.
Yeah.
All right, so your current role, you are Director of Global Strategic Business, is that right?
Yeah.
All right, so
Business
let's...
development.
Oh, I'm sorry, yeah, I
No,
didn't finish the line. Director of Global Strategic Business Development for IVD.
Yes.
Can you talk a little bit about, I guess, your career progression from pathology, PhD, to this director role?
Sure, absolutely. So after I finished my PhD here, my advisor was Dr. Jim Leary. He's retired from U of R now, obviously. Actually, he's moved on to several other positions. But he's still around. He's doing consulting. So, but in any event, he had done some postdoctoral work at Los Alamos National Laboratory in New Mexico. And you use your connections, right? And so between him having the connection to there and them having an open position, I ended up doing a postdoctoral appointment there at Los Alamos National Lab, working still in fluorescence in situ hybridization, molecular diagnostic type technologies, and flow cytometry. So after that postdoc, I did a short-term staff membership there just to extend the time, and then started looking in industry. So moved to a position with Bayer Biological Products in the Raleigh, North Carolina area, and that's where I've been basically living since then. After that first position, I switched to another company that was also based there. It was a French company called Biomérieux. And as it turns out, at one point they decided they were consolidating all their molecular diagnostics work to a site in France. And they said, "Do you want to go?" It's kind of a no-brainer, isn't it? So I went there and spent 4 years there. But when I came back, because they moved all the interesting work, the work that I was doing, over to France, when I came back, I switched again and worked for a startup company, also in the Raleigh-Durham area, called Advanced Liquid Logic. They're like basically a microfluidics technology company. All this time, through this industry track, I've been primarily working on developing diagnostics for infectious diseases, both your bloodborne infections, HIV, hepatitis, also sepsis and some other bacterial infections. So that was kind of all the industry pathway. That company had a very good exit. They sold the company. I got a little bit of money from that. But my project went away, and then so did my job, right? And so I was between jobs for a little while and really just kind of looking around, and I saw a position that basically had all the requirements that, you know, my resume was meeting. And I applied and got it. And I had never heard of what a notified body was. Like many people I know have never heard of what a notified body was. And during the interview, I was asked a number of questions about, you know, what do you know about this or that European regulation? You have to be honest in an interview, right? I'm like, kind of not very much. And they say, "Oh, that's okay. We'll teach you that as long as you have the right technical background." So really, as it turns out, this key skill set for the kind of role that I was doing, namely doing the technical assessment of the company's technical documentation, key skill set is having had industry experience in the specific kinds of technologies and applications that I ended up reviewing. So since I had a fairly broad background with all the flow cytometry and molecular diagnostics and fluorescence in situ hybridization, and had also worked on infectious diseases and cancer, the broader that is, the more advantageous it is for a notified body, because they have to justify the qualifications of their reviewers in the specific products that they're going to review. That was rather a long-winded answer to
No, that's great. And you mentioned a couple important things. It's like, one, don't lie in an interview, right? Because that will come out later on.
Yes.
And it's okay. So in that case, it was totally fine for you to tell the truth, because there are certain aspects of a job where it's teachable. You don't have to know everything.
Exactly.
But you had the technical background
Right.
that was needed, and they knew they could train you on everything else.
Exactly. Yeah.
And so, is there a typical day in your role, or do things change all the time, or what does that look like?
Yeah. So with this most recent transition, I've moved from one notified body to another, and with that transition, I have a new-ish role. I've been doing this for a year. And it's no longer really doing the technical work. It's more in the business development side of things. So on a given day, I might be doing some market research, looking at a particular region or a particular kind of technology space, looking what are the companies that are out there. Of course, they could be potential clients for us if they have plans to launch into Europe. So that could be one day. One day I might be at an international conference presenting on what are the requirements of the European regulations, and of course then also in the context of that, making contacts with existing clients, saying hi, keeping the contacts up, and making sure that they can tell us if anything is not going as they would expect. And also looking to see who's there, who's developing new things, and who might benefit from the notified body service. So it's very variable.
Yeah.
And that's one thing that I really like about it. I know some people are really happy having a routine, knowing in the morning I get up, I do this thing, I finish, rinse and repeat.
Sure.
Right? That's not so much me. I'm happy when, one day I do something and the next day I switch and do something entirely different.
Yeah.
So, and this position really feeds that desire to have variety.
Were you, in your technical role,
Yeah?
were you client-facing at all, or was that kind of a big change for you in this more strategic role?
It's a bit of a natural progression. So in the technical role, once you've completed your first pass review, you have to have a meeting with the client to talk about any gaps that you've identified and things like that. So that piece is clearly client-facing.
Yep.
The other parts of the role that I did, and it varies from one notified body to another and from one individual to another. But in some notified bodies, you can be a technical assessor, which was my main job description, and an auditor. And so as an auditor, of course, you go on site at a manufacturer's facilities and you go verify that all their processes are under control. And so that's clearly also a client-facing aspect of it. And even then, when I was primarily doing technical stuff, I did also have the opportunity occasionally to go out and do a training or present at a conference.
Okay.
So because that position already had some client-facing parts in it, it was a relatively easy sort of segue into becoming all client or more client-facing, and spending more time interfacing with the customers.
So you weren't, it wasn't just sitting behind a computer working on documents or reviewing documentation, things like that, you're actually probably a lot of Zoom calls, I'm guessing then.
Yes, of course. Of course.
If you're working from home, but okay,
Yeah.
so like you said, natural transition.
Yeah.
What, I guess, and we probably have hit on this a little bit, but specific skills that you would say are essential, or have been essential for you in the regulatory affairs space.
Yeah. Aside from the technical skills, which we've talked about, I think it's kind of important to have a fair level of confidence in your competence. And I know that's really something that a lot of people struggle with, especially people that are just coming out of, I've finished my education, I've been the person receiving knowledge. Now all of a sudden, I got to be the person who has the knowledge and does something with it. You have to keep in mind, you make the decision primarily whether a device is going to be safe and effective. Right? So you have to be sufficiently confident in your technical knowledge to say, okay, I understand this device well enough to know that the data that the manufacturer has presented is adequate to demonstrate the safety and efficiency, effectiveness of the device. And even for me initially,
I was going to
not
ask.
just even for me, but I think maybe for everybody initially, that's the part that's most difficult. Understanding the device and reading the data and all that, easy. But then saying, would I feel comfortable if this device was used on one of my loved ones? Right? That's my litmus test.
Okay.
Right? So, and if the answer to that is no, you have to be confident enough to say, you know what, you don't have sufficient data. And that is actually pretty hard because, especially if it's, say, it's a startup, they have a project that they think is really cool. Now you've called their baby ugly.
Yeah.
And you have to, aside from the hard technical skills, you have to develop a lot of soft skills to be able to convey those messages in a way that, that they're received well and that, you're impacting people's livelihoods sometimes too. So that's a really tough position to be in sometimes. But I think in the end, the only standard you can apply is, will it benefit patients in the end? So I don't know if I answered the question exactly.
Yeah, and you have to, and I guess, you said that was hard for you coming out, and probably is for many folks coming right out of a graduate school program or early in their careers, but is that just something that comes easier with experience, or?
It does,
Yeah.
It will, and I think in general notified bodies and probably other regulators too have an appreciation that that is not the easiest thing, and there's actually a fair amount of training and mentoring that you have to undergo before they turn you loose on your own, right? And so, I had to do, for each of the kind of major technical areas that I was qualified in, I had to do a number of mentored reviews, and then the mentor would be there to backstop and to firstly verify that what I was saying actually made some sense and it wasn't just pulled out of thin air. But also then to support when there is a decision that's a bit difficult. I've had a couple of cases relatively early on, as it turns out, where we had to turn down a manufacturer because they simply couldn't get sufficient evidence or didn't have sufficient evidence to support the safety of the device. And those were difficult conversations initially, but then with some support, we say, yeah, okay, so I was right to have my doubts about this. And
You get a little more confidence.
Yeah, you build confidence with experience, just like anything else. You know? It's like riding a bike or anything else. You have to practice it, and it comes.
Is there anything you would have, you know, if you could go back to graduate school and do anything, whether it's different or focus more on certain training or things to set yourself up for a career like that? Is there anything you would go back and do more of or do less of?
That's a really good question, and I've spent a little time thinking about that since yesterday. You know, on the one hand, when you start out on a career, you may have a particular goal in mind.
Yeah.
But you don't know whether you will actually get to that goal or whether, in fact, that will remain your goal. It changes, right? When an opportunity arises, you might take that opportunity, even if it's a little tangential to where you thought you were going. But with that said, I think even while I was a grad student, I had some ideas that most probably I would want to go into industry rather than academics. Part of the motivation was because it's closer to the patient, has potentially a more direct impact than the basic research. Not knocking basic research, we need it, you know. But for me, being a bit more applied is preferable personally. Plus, of course, having been in a university lab and understanding how the grant writing process works, I just never really liked writing grants.
I understand that.
I liked it even less when I spent all the time writing them and then they didn't get funded. What I might have done more of in hindsight is get a bit more my head into what does an industry position look like? What is a company going to be looking for? What kinds of things will, you know, help you transition into industry? Could I have spent more time working on doing, say, writing study reports and things like that, and get into medical writing frame of mind? Because if you're doing regulatory affairs in a company, you're doing a lot of technical writing. When you do the review, you review someone else's technical writing essentially. But so things like that, kind of, if you think you want to go to a particular place with your next career step, do more research to find out what are kind of the key things that they're going to be looking for. And it's probably a little easier now than it was when I came up. You can look on LinkedIn and see what are the requirements on the kinds of jobs you think you want. And then you can start thinking about, in my role as a grad student or as a postdoc, where do I have opportunities to do some of those things? Also, give yourself credit for what you actually do have in your background. If you've been a PhD candidate and you've been working in a lab for 3-4 years to do your thesis, and you've had a couple of years of postdoc, you have 5 years experience. It's fine to put that on your resume, right? Don't say, oh, I'm fresh out of school, I have no experience.
Because it's not like in your PhD you're sitting in a classroom and listening all the time.
Exactly. It's like you're actually creating work output, right? So, and if you're, you know, the senior grad student in a lab and you have some undergrads rotating in and you're kind of managing what they're doing, you don't want to say, okay, I have experience as a manager, but you can clearly say, okay, I have experience leading a small team. So those are things that you want to keep in mind, and also look for opportunities during your graduate work and postdoc to do those kind of activities more.
Yep.
so that then you're better positioned when you see these requirements of this much experience and leadership and this and that, medical writing, and you can say, okay, tick, tick, tick. Then it's only a question of adapting your resume to that job to make sure those keywords are there.
Yes.
So.
And that's where somebody like Eric Vaughn could probably help him out.
Absolutely.
Shout out Eric.
Right. Yep.
Based on your experience, we're fresh off of commencement here as we record this, so and lots of folks, I'm sure, either defended or recently defended or getting ready to. Any kind of trends that they should be aware of, or anything changing in whether it's in the IVD sector or regulatory affairs in general? I mean, anything that folks should be aware of or looking out for?
Well, I almost feel embarrassed to bring up the buzzword of AI, but AI isn't going to take away your job as a regulatory professional, but somebody who uses it will.
Okay.
Right?
Yeah.
And what I mean to say with that is, yes, as far as I can foresee, which is limited, of course, right, and always subject to interpretation, but as far as I can see, there's always going to be some need for judgment. If I'm reviewing a file and I see, okay, these are the data that they show, and okay, maybe they could have more, but on the other hand, I know where the pitfalls are in the technology. They have other supporting data, and the whole picture together gives me sufficient confidence of the performance and safety of the device. It's going to be a long time before an AI can make that decision. On the other hand, when I do a review, I have to fill out several different forms, and I have to put in, okay, what's the intended purpose of the device? Where are they addressing this, and this requirement? And you could very easily see an AI tool go parse through the 700 pages of documentation and say, okay, this is where it is, pop it into your form, right? So those kinds of things, I think, are clearly going to be coming in. What that means is, in my mind, it means you get to focus on what's the fun part of the work, right? Doing the technical stuff. And nobody likes to fill out forms. So if you can get an AI tool to do that for you, you still want to check, make sure it makes sense when it's put there. But so that, I think, is a trend that's going to be in all industries to some extent, right? But this is no exception. Of course, you have to make some effort to keep up with technological advances, right? I think we're looking at a $100 genome, for instance, is either a reality or a near reality today. Okay. If somebody can sequence the whole genome for $100, then that means for that amount of money, they have information on any number of disease states, predispositions, things like that. And that's going to be a big challenge. How do you regulate something like that? Because there's a lot of privacy concerns in there. Do you need to make sure that your insurance company doesn't know that you might come down with XYZ disease in the next 10 years because they'll raise your rates? And on the other hand, if I create a device that says I'm going to sequence the genome and I'm going to have information on these 200 conditions, you're going to have to demonstrate some proof that, in fact, you have information on those and that information is accurate and useful. So the burden of doing the regulatory side of something like that could very easily outpace the burden of actually doing the technical side of things, right? Because that's going to become more and more routine to do that. Sequencing a genome is already pretty, I don't want to say it's standard, but it can be done. And it's getting quicker, easier, faster. all the time. So those kinds of things, keeping up with the technical advances, but also looking at what are the implications. Right? And at some point, you're going to find yourself wondering, what can I do to impact policy making, right? Because right now, a lot of the regulatory frameworks are one device, one condition, right? Now, if I have one device, all of the genetic conditions under the sun, you're going to need a different model to do a reasonable job of assessing that. So those are a few things I think that are kind of coming down the pipe that will keep people both awake at night and busy.
Yeah, great opportunities, and
Yes.
For those coming up that have that opportunity to stand out or make an impact. So that's great, Stefan. And before I let you go, I do just have a couple quick sort of, maybe, I don't know the right term, lighter questions, or just not so career specific, but you said it's been a while since you've been back in Rochester. Before, when you accepted to go to a graduate program here, what was it that attracted you to the area or to the school?
Well, I was already living in the area.
You were already living here, okay.
So kind of staying local was sort of the obvious thing. And I grew up in Germany. I finished high school there, and then I moved here. My mom had previously moved over to Niagara Falls, so I was there, met my wife. She's from Rochester. I moved here.
Interesting.
And at that time, I wasn't actually looking at college at all. I was just working in a job, right? I had finished high school. I said, I had enough of that for a while. That's soon enough you figure out, okay, working night shift at Tops isn't going to be my career, right? So then I decided to go back to school. I went to MCC, part-time, and talk about a sliding door moment, right? So when I got my degree, I did two things. I applied to some jobs, and I applied for a transfer scholarship to RIT. And my thinking was, okay, if I get the scholarship, then I can afford to go to RIT and continue. And if I don't, well, I'll take this technician job and work in that. I got the scholarship, and I actually ended up doing both because RIT has a co-op program. So I could work for that company for 6 months and then 6 months going to school. So, and then after that, I went looking for technician jobs for somebody with a fresh bachelor's and a year's worth of experience. And I actually looked at this is dating me a little bit, at a bulletin board posted in the medical center saying what kind of jobs are there. And there was a technician job posted in Jim Leary's lab.
Okay.
And I applied for that, ended up getting that job. And he's the one that then encouraged me after a couple of years saying, you know what, you think you want to do a PhD? And I'm like, you know what, I think I do. So sometimes it's serendipity comes into play, right? It's like, okay, it could have gone either way. And it probably would have been fine either way, but it just, it went that way. And then I landed up in a lab with somebody who was interested in mentoring me into doing an advanced degree, and I did that. So that's how that all came about.
Okay. Interesting with the Niagara Falls piece. My wife grew up in Niagara Falls, and I met her. We met in D.C., but ultimately moved back to Rochester to be closer to her family. So that's funny. Yeah. When you weren't doing your graduate coursework, where could people find you when you weren't working or in the lab or whatever you were doing here? Boy. What were you up to in and around the Rochester area?
Well, by the time that I was into my grad school, we had a young child.
Oh, okay.
So you would probably you would find me at home working on that. During undergrad, that was a different story. I'd be out at the bars and, listening to loud music and things like that. But then once the family thing comes into play, it does change things.
A little bit.
Yeah, a little bit.
Any particular restaurants or places you have to visit while you're in town before you leave?
I don't know that I have any specific ones in mind, but when we lived here back in the day, we used to go to Mama San's once in a while, and I was really surprised that not only is it still there, but it's now right here.
Yes.
So I did go there for dinner the
Great.
other night. Yeah.
Great.
So, but yeah, I don't have any real specific ones in mind that I need to go visit.
Okay. Well, this was great, Stefan. Thank you so much for joining us. Before we go, is there a place, if trainees watch this and have a question or want to follow up with you, is there a place they can connect with you?
Of course, they can get my LinkedIn profile.
Okay.
If you just search for my name, I think I should come up. So by all means, contact me, follow me, request a request to connect. Just kind of remind me that you're actually here from U of R, because I do get a few requests here and there from anybody, and I kind of do like to keep a little bit of a tab on whom am I actually connecting with.
Of course.
So, yeah, by all means.
Maybe mention you watch this podcast or listen to this podcast.
Exactly. That would be great. Yeah,
all right. Well, again, thank you so much, Stefan. It was a pleasure.
Thank you. It was a great pleasure being here.
Thanks so much for tuning in to the latest episode of the Next Step podcast. If you liked what you heard, please share with other members of the University of Rochester community or anyone you think could benefit from these career stories. And we wish you nothing but the best in your own career journey. Until next time.